Welcome to Yesterday, Today, Tomorrow. My name is Mariana Cordier, and I am your host. It's Mental Health Month, and we should continue to have conversations regarding reducing stigma, especially among communities who resist getting help. Joining me today to discuss all of this is Sonya J. Bruton. She's Chief Executive Officer and President of CCI Health and Wellness Services. We also have Dr. Mariana Falconier. She's an associate professor at University of Maryland. Also joining us is Viviana Azar, licensed marriage and family therapist, and Dr. Eunice Humphrey. She is CEO of Consulting Inc. and a licensed clinical professional counselor. Ladies, thank you so much for joining me. I wanted to start off with Sonya about, what is the reason for resistance to getting help when you have a mental health issue?
Thank you for the question, and it can have so many different answers depending on who's being asked it. So I spend most of my time as an administrator, but I am a clinical psychologist and have treated patients and treated them in a variety of settings. And what I find is any stigma that comes or any barriers around care really come from cultural norms. And so that as the culture makes it okay, then the willingness to go and seek help expands. And what I am seeing is that more and more cultures are recognizing that everybody needs help. And that help can't always come from someone in your house or someone in your community, that sometimes it really needs to come from professionals.
It's fascinating because in my office, when I was getting ready for the show, I was talking to my secretary about it, and she mentioned to me that some folks, for religious reasons, actually have a resistance to therapy that I had never even considered, that they don't believe in, I guess, getting medical assistance for mental health. Have any of you run into that?
Yeah.
Mariana?
Yes, no, I've run into that several times. And as Dr. Bruton was talking, I was thinking how important it is, not only for people that are, sort of conflicted with some religious values and beliefs that perhaps make them more reluctant to go to therapy, how valuable it is to have, important people that are sort of a reference for them in their lives, that they really look up to them for guidance. So the work of the mental health field many times is close to leaders in the community, like priests, pastors, and those are the ones that can also help their congregations, the people they work with, understand the value of getting help in time for themselves, for their families, and how to reconcile, other, values and beliefs that may be competing. And following with that, I think that that's the stigma that many people associate with mental health goes down every time we have a celebrity or a big name, not just a religious leader, going out there and saying, yes, I've been struggling with depression. I've been struggling with an eating disorder. Just to mention the example of Prince Harry at some point when he was actually sharing what it took for him to be processing the loss of his mom and all the behavioral issues and depression he struggled with. So I think to reduce the stigma is tremendously important to work, with those that have a powerful voice in our community to reshape the narrative around what's like, to be struggling with depression, anxiety, and all these aspects.
What is it? What is the stigma? I mean, for those of us who are not as aware, like, I have been lucky enough not to have that, but when someone says to me, I don't feel comfortable getting help, and I'm like, why? Yeah. So what is the stigma that people face that they find it as a barrier to not getting care?
In my experience, it has been, people think of the old days of mental health hospitals and people being crazy, and that's what comes to their mind. And so they say, I'm not crazy, but what does it mean to be crazy? And if I am experiencing symptoms and I cannot take care of myself and I cannot share what's going on inside of me with my loved ones, but inside I'm going to explode, or I cannot sleep, or I cannot eat, or I eat too much, or I sleep too much. And people are saying, well, just take care of yourself. How come you cannot get out of it? Well, if I cannot get out of it, it's because it's beyond me and something is happening that I need to seek help. So the first thing I tell people is, when you have a heart problem, a heart condition, when you have diabetes, what do? I go to the doctor. So when you have a mental health issue, why not go to the doctor? Why not consult with somebody? You tried it, you spent 3 months trying to fix it, and now you're still feeling badly. You're still anxious. It's okay to get help.
And it's dangerous. I mean, there's a lot of danger. Sonya, what do you think about the stigma aspect of mental health?
Yeah, I was going to add to that, you know, it's the judgment. Yes. People feel like they'll be judged because they can't just shake it off, or they can't make themselves better. And so one of the things that we do in our setting is combine it with physical health care and oral health care, so that it normalizes that it's just another system of your body. When you're looking at whole health, you have to take care of the mind, the feelings, the physical shell, and what's going on in your mouth. And when you put that all together, it normalizes it, but it also allows them to be in a setting that nobody really knows what they're seeking care for, so that we're able to have someone who's coming in to address their mental capacity or their mental situation or their emotional feelings. And no one has to know. And we encourage them, if they don't feel comfortable saying, not to tell a parent or a sibling. It's usually hard to hide it from your spouse, but in some cases that might be happening too. But the stigma is around, I'm being judged because I can't figure it all out myself.
But what about it? Go ahead, Eunice, go ahead.
So just quickly, I also just wanted to, one of the things that we also notice is that oftentimes people think that when they're seeking help, they're automatically going to get a diagnosis, that you're automatically now bipolar or schizophrenic or depressed. That's not the case. That is not the case. Sometimes we just need tools. And sometimes we just need that assistance, that help to cope with whatever we're dealing with. When you think about grief and what we've been through, right? And what the country has been through, everybody's coping and trying to figure out how to deal with this new normal. And so it's important to understand that coming and seeking help has nothing to do with now being pathologized or getting a diagnosis or getting put into this place. But if you do, it's also important to understand that it's important to know what's going on in order to get the right treatment. And so it's one of these balances where you really have to recognize your body, your mind, and really seek that. But and I agree, making sure that we as counselors are also aware of the cultural implications that come when one of our clients is not from our same background, and making sure that we're also addressing and dealing and helping them in the best way that's going to help them and not just for us.
Well, and you know, one thing that I noticed is that I don't think that kids today are really taught, along with math, English, reading, and everything else, how to cope with emotions. And then they grow up and the lack of coping continues. I mean, I think coping, would you guys say, is a skill that we need to learn?
I can I work in child and adolescent behavioral health services in Montgomery County, and there is a big push for taking into consideration social and emotional development in children in the schools. So we are trying to teach kids how to recognize their emotions, how to cope, how to de-escalate, how to learn mindfulness skills in the school. So yeah, we are trying as a county to bring the learning into the schools, and also when we work with kids in the clinics, of course.
Yeah, I mean, you know, nobody learned how to lose a loved one or how to lose in a game, or, you know, not everyone is successful and there are hurdles and stuff. So, you know, all of us are trying to survive, but, you know, how do you recommend for parents and family members that are having difficulties in their relationships to recognize that this might be, a thing of mental health, something that they're being affected by mental health.
I'll jump in on that one. One of the things that I like to say and demonstrate is, coming to see any one of us or a professional, you do that when something in your life is breaking down. Doesn't mean you're broken down. It just means your ability to love, to work, to think, to understand yourself has broken down, is not firing, has some questions somewhere along the way. I'm going to see, I'm the CEO and president of a health system, but I still see patients every month for testing to help them understand how their thinking is going and how their feelings might be impacting their thinking. And I'm going to see somebody in the morning who 22 years old, and she keeps losing jobs. And so all of a sudden, what she's ready to admit and face is that she might have a learning disorder. And she wants to go through the testing to answer that question. When we answer that question, she'll get a roadmap that will help her be more successful by understanding the ways in which she thinks, where she's strong in it, where she might have some weaknesses, and how she might make them all stronger through the interventions that we have. But the key for everyone to know, just like Dr. Humphrey was saying, it's not necessarily that you have a disorder or some kind of condition that you'll carry with life. We can help people in whatever area has some gap, some breakdown, something that's not going smoothly.
And Mariana, with families, when they are having, whether it's something that happened or a tragedy, or just people having tough characters to deal with each other, what is your recommendation to them to help get over these difficulties?
Well, I was going to jump on the previous question and the answer.
Go for it. Go ahead. Yeah.
No, but it's also similar to what you're asking me now. I've been working since 1992, and my experience have taught me that I don't push therapy onto people. I don't go around convincing them that they have to do therapy. What I try to do is open up spaces and opportunities for them to share what's going on. And in the conversation, different types of possibilities of help may come up. So I'm saying this because sometimes people are more open first to go to a parenting class before going to family therapy. Sometimes they may be more open to go to a yoga class before addressing their symptoms of anxiety in the context of therapy. Sometimes they're more open to talk to a friend or talk to a religious leader, or or go to a support group. And what happens is that when there's a greater need, the opportunity comes up there for the person to own more that need. And always things work way better in therapy when you have someone motivated and open for change. That has always been true across all modes of therapy and all contexts. So anything we can do to help people to get in touch with what they acknowledge, that, as you know, Dr. Bruton was saying, that there's something there that I'm not working the way I used to, I'm not loving the way I used to, something is there different and it requires attention. Now, going back to your question, I also think that it's many times easier for a couple to go to therapy or a family go to therapy rather than an all together and sort of sharing in that sort of like problem that they define, rather than pointing to one specific family member and saying that's the problem. Because just the act of going and seeking family therapy altogether is a family commitment to working together. And that's an amazing beginning, and it changes the dynamics of, there's one to blame, there's one that have a problem, instead of all of us looking at how we contribute to certain dynamics and things. So I always think that family therapy is a great way to start. And sometimes people find themselves saying, I need more space for myself. Can I have, my individual therapy? That happens a lot.
Eunice, what about employers? Is that something that people are scared their employer is going to fire them if they find out they're getting counseling or therapy?
So I think that there's, yes, there's always that fear, right? But I think more and more now we're encouraging, we're saying, do it. find somebody, let us help you with resources. I think even in your previous question, like the one thing parents need to do is even find if they have something wrong. Children are observing us all the time. And so they're learning from observation. So we as adults need to be able to model what to do when we're not feeling okay. So that's the same thing even in the workplace. We're encouraging people, go seek help, find what's going to make you healthy, because the only way that we're going to have a system that is producing what we want, whether it's in the school or any type of goods, is if we have people who are healthy. And so we want to make sure that healthy is not just physical, but mentally. And so you want to make sure many employees are now really encouraging their employers to, if they need the help, to really seek it. And so I would say definitely take that. Every organization has different resources available. And so I know school systems do, I know other organizations do. So we really want to encourage that. And we also want to encourage for parents to not only look within themselves, but you can start seeing some changes in your child. And you can start noticing some things. If you notice that, say something, seek help, whether it's in the school and the school counselors, or if it's outside agencies through, the different nonprofits, but say something if you see something. That's really important.
And go ahead, Viviana.
I would love to add that sometimes, parents see kids, the only thing they see is their kids misbehaving. And they think they're just malcriados. I don't have the word in English. Spoiled. Yeah. And that's, sometimes kids cannot express how sad they are, how the pandemic impacted them. And the only thing they can do is act out. So I go with you, Eunice, that ask if you see change in behavior, if you see change in mood, ask them, how are you feeling? I know this has been hard on you. Recognizing that all of us went through this pandemic and it has caused a lot of stress in families, and we're not recognizing the impact of the stress in ourselves and in others. And when we are very stressed, we become more irritable, we become more impatient. So we need to pay attention to our behavior with our loved ones and how that's impacting their mental health.
And, you always hear every now and then that one person that when they see a family member or a friend or someone struggling, and they say, you just got to man up, or you just got to be tougher, the British stiff upper lip. What do those people need to understand?
What they need to understand is that this is everybody's walk is going to look different. You can't compare yourself. Some of us are introverts. So this pandemic really didn't make a difference. This is our norm. Some of us are extroverts. So we miss the hugs. We miss everybody's going to be different. And I think when we understand that people deal with situations in a different way, and that we, instead of trying to compare ourselves or trying to tell somebody to be stronger, to be different, that we instead show compassion, show, empathy, show that we are actually going to be there to care. I think that's when we're really going to start seeing a difference. And so I would say to that person it is important to understand that unless we're walking in that person's shoe, we probably cannot really speak to what they're going through.
Yeah. So what do you guys see from here forward? The pandemic is starting to ease up for now, hopefully for forever. But what do you see some of the challenges for folks in mental health in our immediate future?
In the context of the University of Maryland, where I am, I've been sort of like working with different groups into how to help people come back. Come back to what? We talk about coming back as if it was coming back to the context we had before, and we're coming back to something different. We have changed, we have been transformed. People around us have been transformed. The places of work, the schools have been transformed. So we're coming back to something that we don't know really well. So there's a lot of uncertainty. There's a lot of anxiety around what it's gonna look like, what's gonna feel like. And so it's a big transition. But I would say the good piece about this transition compared to suddenly disrupting our lives overnight is that now we have a little bit of time to planning a little bit more. So all the work that we are doing, at least in the context where I work, is about planning. And planning meaning taking the time to think about how we want to come back. What are the things that we can keep from this pandemic that are of value? What are the things that we are looking forward to returning and recovering to some extent? Trying to sort of anticipate to the best we can our challenges, but also remaining planning, but remaining flexible, knowing that not everything will be under our control, and having in place some mechanisms to manage the stress, the anxiety, and that goes, from mindfulness activities to coping. You were talking about before about coping, lots of emotion regulation to understand yourself and understand others. As Eunice was saying before about compassion to ourselves and to others. Adults will need that. Kids will need all this from adults around them to be able to support them in that transition. But I would definitely say, looking at all this to, take care of our mental health, of our emotional health in our return to whatever we return.
Sonya, what did you want to add?
That two things. One, some people won't have expressions of issues until it's over. They can hold it together and then it all releases. And I think the second thing is that nobody's ever complete. And there are going to be some people who have sought care in the past, and they may need a tune-up right now. And that's okay too. You could have learned coping skills and you could have gotten through issues in the past that have resurfaced, and you might need to come back again for more help.
And Sonya, what about, folks that for the first time are unsure on how to reach out to find the type of counselor that they need or a therapist? How do they go about doing that?
There are lots of ways to kind of find out what you need, but it really starts with being honest and okay with the answers that you have inside. And so therapy is an intimate collaboration and partnership. And so for some people, it's okay to recognize, I want somebody who's my same gender. I want somebody who's similar to my age, or I want somebody completely different than my age or my gender, so that you start with who are you going to feel most comfortable talking to, and then finding that resource in the many places that we can go to for help. And you can start with your doctor's office. Your doctor can help you find a resource.
And Eunice, what would be your answer?
So I think it's important to, just like everybody's saying, right, look within yourselves, but then also understanding that there's gonna be a new normal. We don't know what it's gonna look like, right? Coming back to school, going back to work, it's just gonna look different. And so recognizing that from the start, but then also knowing that one of the things that we have seen now is that there is a need for mental health providers. And so the one thing that we also is that we can do it in this format. You don't have to necessarily leave your home now. We can meet in this way and provide you with the services that you need. So really it's going to be about you seeing, I have a need, and now let me look for the resources in order for that need to be met. And so it's really important that we recognize that and that we're able to see that.
And I think we're almost out of time, but with about a minute and a half left, Mariana, I'll give you the last word. What do you want the audience to take away at the end of the day?
That when we talk about health, it's not just physical health. It's also mental health. When we talk about public health issues, we should be talking also about mental health issues. And you have to take care of your mental health in the same way you take care of your physical health. You have to pay attention to it and be able to read the signs of when things are not going okay and get the help you need.
Well, I still have a little bit of time. Anybody want to jump in with one last word?
I would like to add, in terms of the experience with the pandemic, that many people had found ways of being with their loved ones and enjoying each other's time. So remember those times and do more of that, because we're going to go back to another rhythm. And going back to what, no, those were my last words, sorry.
That's okay. That's okay. Well, we've run out of time. I really appreciate you ladies joining me. This has been very informative, and hopefully the audience takes it to heart. And if you need help, please reach out and get help. It's there for you. I'm Mariana Cordier. You can catch us yesterday, today, tomorrow on Facebook and YouTube as well. Till next time. Bye.